Hello, thank you for tuning in. I'm Echo Menges for NevoNews.net and the Edina Sentinel, and I am here at the Knox County Health Department with our administrator, Lori Muth-Claire, and Mason Alley, also part of the Knox County Health Department team, and they are going to give us an update, a situational summary on Knox County and where we're at with the COVID-19 pandemic. So I will just give it to you guys. Take it away.
Oh, yeah. So actually, just starting off case-wise, and I have to read my posted just because it was actually just updated moments before we started this. So earlier this morning, we were sitting at 957 cases, about 13 fatalities, and now the most recent numbers I've got, we're sitting at 1,035 cases and 14 fatalities.
In Missouri.
Yeah, in the state, I apologize. So in the Knox County area, we have 0 cases, 0 fatalities associated with COVID-19. But state of Missouri, just over 1,000 cases, about 14 fatalities. Compare that to a week ago, Tuesday, so we were sitting at 227 cases and 6 deaths as a state. Nationwide, we're looking at just about to cross 150,000 cases, 2,800 fatalities. I wish I could pull numbers from a week ago, but again, they're just rapidly changing nonstop, day by day, hour by hour. For what we call Region B anyways, it's a 16-county region up in the northeast Missouri, makes up 4 columns of 4 counties in each of those. We actually are sitting at 10 cases right now, but again, 0 cases in Knox County. Our closest would be the one that was identified in Adair, the one that was identified in Shelby, and I believe the 2 that are identified in Randolph. But again, 0 in Knox County cases or fatalities associated with COVID-19. It's also important to note that of those cases in the entire state, half of those are under the age of 50. So I mean, this is really why we're trying to stress the idea of not only social distancing, but the importance of self-quarantine. So if you are healthy, but there is risk in your community, that's why we encourage that you stay at home to just further prevent yourself from becoming a case or potentially spreading a case to other individuals. Should be noted just kind of projections wise what we'd be looking at, and I'm pulling this off of the Institute for Health Metrics and Evaluation. Currently right now it's estimated that Missouri may experience our peak, or at least become close to a peak, in approximately 40-ish days, but again, that's all very rapidly changing, and just as the situation progresses and we see more community spread within certain counties that already have cases existing, or counties that may be getting their first cases here in the next coming days or weeks, those numbers could be pushed back every which way. I mean, it's also unsure just how much the new upcoming spring climate, I mean, I'm looking out the window right now, it's 60 degrees and sunny. I mean, we hope that that would have an effect on this virus, but at the same time, it's just a little bit too early to tell whether or not that'll have a true effect on actual caseload and spread within our communities.
Okay, and as far as like, can you break down the numbers as far as like our most at-risk demographic that we have data on, you know, people over 65 for Knox County specifically?
So I can, and again, these are all just pure speculations. I'm going to break down these cases. It's not numbers that have actually been purported, so I don't know off the top of my head, and I don't claim to know that we would get 10, 50, or 75% of this crowd infected, but I just think that these numbers are easier to visualize. So the numbers I have pulled would be 10% of that crowd, 30%, so just about a third of that crowd, and then 50%, so half of that crowd becoming infected. So for Knox County, we're sitting about 973 individuals over the age of 65. So let's say we had...
Before you go on further, that's just people over the age of 65.
Over the age of 65.
So basically we're talking about a county that's about 4,000 people total population. And so we're about a fourth of the county is over 65 years old.
Correct.
Is that disproportionate? You know, is that a higher number of older people than areas?
I would say yes. Probably. Traditionally, we have had a disproportionate number of senior residents.
Okay, so we have about 1,000.
Correct.
Okay. Okay.
Yeah, no, and that's why, again, before I start in, there's nothing to necessarily say that we would get 10, 30, or 50% infected, but just that I think that these are a little bit easier numbers to visualize. So for those 973, if we had, say, 10% of that crowd become infected, we'd be looking at about 97 cases. And then if we estimate that the numbers given by the World Health Organization, where 6% of those were termed critical, essentially needing hospitalization and ventilator access, you'd be looking at about 5 to 6 individuals needing that ventilator access. So if we bump up the scale a little bit, and let's say we just kind of speculate and project maybe a third of the cases, a third of those individuals become infected. So in that hypothetical scenario, you'd be looking about 290-ish cases. And then again, from that 6% given by the World Health Organization, you'd be looking about 17 to 18 individuals turning critical, needing that ventilator access. Then again, just all the way up, just turning up the knob a little bit more. If we think about, and again, I wouldn't necessarily anticipate this, but it doesn't hurt to think about, to actually visualize, if theoretically 50% of that population became infected. In that instance, you'd be looking about 485-ish cases, and from that 6% needing about 29 to 30 individuals being placed on ventilators. But again, those are all hypothetical numbers just to kind of get the public to visualize necessarily what we may be looking at if we get 10, 30, or 50% of that crowd becoming infected.
Right, just to be clear, these numbers are just to give an example of how many people could be affected, if a certain percentage.
The 6% turning critical is information given by the WHO, but the amount of spread that I've given, the 10, 30, or 50%, those are just hypothetical simulations.
Okay, so now let's talk about ventilators. How many ventilators does Knox County have?
So for the county itself, not having an actual hospital, it would most likely just be limited to what the actual ambulance crews have, which off the top of my head, I unfortunately don't know. As for ventilator access at hospitals, I would have to actually check with the facilities to see what they would have. But again, the thing with treating these COVID patients who would actually are confirmed positives, they need to be treated in what's called a negative pressure room. So essentially, if I'm in this room, all the airflow is being sucked back into the room rather than letting it go outside to the rest of the facility.
So having negative air, the negative airflow room, that's just as critical as having a ventilator,
correct.
Right?
And then the amount of beds that they would have available for those rooms. So I can't think off the top of my head from the numbers I've pulled for the hospitals in the region, because there are a few hospitals that I know of that just don't have negative pressure rooms. It's just simply that their facilities don't have that capability. Now, our closest one, I know Scotland, I think, has a couple anyways, and I can't attest to how many the others in the regions have. But again, it is a limited number, and if we're seeing so many individuals in each and every county falling ill and needing that access, I mean, it's kind of easy to see how we would be overrun in that situation. And that's why we're really trying to push the idea of mitigation, and again, flattening the curve. So even if it lasts maybe a little bit longer, at least we see fewer individuals sick overall. At the same time, those sicknesses are spaced out. That way the healthcare system has time to maintain individuals in those rooms and on those ventilators and clear them out and get them recovered by the time the next individual falls sick and needs care.
Okay, what else does Knox County need to know?
I think that everybody's interested in the fact that the president extended the kind of physical distancing order yesterday. Going to carry it through the end of the month. I think a lot of people are questioning what we'll do with our local order that is set to expire next Monday, April 6th. Those decisions will probably be made the end of this week. At this point, the public health recommendation would be that we continue this physical distancing order and try and stay on top of the mitigation so that we don't encounter this overrun of COVID that we're seeing. I think I would also say I don't want people to be lulled into a sense of self-security because we don't have a positive case. As we all know, testing is not widespread right now. We have had some private tests come back for Knox County. They've come back negative. We've had some self-monitoring, some self-quarantine. We still have some going on. But to think that because we don't have that number one case yet, that we're all still okay is a false sense of security.
And is that partially because there's not really any testing going on?
There's not a lot for our area. And it could be that the disease is in a population that hasn't sought the need for that, acute care at a hospital level yet. So there's still a lot we don't know. I know that it's in every little county almost around us now. We've got a little pod up here in the northeast corner that it's not, but we have to treat it as if it's here, and we have to stay ahead of it, because although we're up here in rural Missouri where everyone knows that rather than being stocked on top of each other, this is better, right? This is better. But if we also have some deficits, and that would be in the number of the number of people to treat us. Access to health care is going to be limited up here. So we have to mitigate, and we have to push this thing off as long as we can and stop it as best we can before our population would see a lot of positive numbers.
Because essentially it could be devastating.
It could be. And I know everybody feels almost a sense of devastation right now. I saw it over the weekend. I saw it on Friday night when we were honking and waving at each other while we cruised. I think it's different. I told my husband that we were home for 4 weeks with a snowstorm last year, and I don't think anybody felt that sense of lockdown that we feel right now, you know, that craving to be out and about and with other people. But what people really need to understand is it's just begun. And I think we talked about that 2 or 3 weeks ago when this started, that, you know, we're starting this early so that we can get ahead of it. But it is not over. It is not near over.
It's still kind of just the beginning.
It's just the beginning. And we need people to pay attention to the physical distancing and the stay at home. And that brings me to some concerns that I would bring forward. You know, I went out and drove around over the weekend. I don't want people to think they have to stay in their house, because mental health issues related to this distancing can be a problem. You can get out and get fresh air. You can sit on your front porch. You can mill around. You can walk. I'm seeing a lot of kids that are getting together that I know are not from immediate family member households. And I see them walking down the street shoulder to shoulder, or riding bikes shoulder to shoulder. And I watch them stop and talk to the next pot of kids and the next pot of kids. So what we have to remember is that they have the potential to carry or expose any of those households they go home to. So although I want your kids to be out, if they are going to face-to-face talk within 6 feet, they need to be doing it on their electronics. And like every other parent in Knox County, my kids have had enough electronics over the last week or so. But we cannot afford to let this stuff go. And I know people think, oh, it's just a few kids, you know, everybody. But we let something slide, and that's where the disease has the opportunity to creep in. So parents out there, adults out there who feel the need to kind of get together and haven't been able to put off, I'm going to ask you to please monitor the physical distancing. Keep that 6 foot between you. Spread out. Let's hang in there a little bit longer. I know it's tough, but we need to do it.
Can we talk about some of the why, as far as, because I read a lot over the weekend, and it seems like the more we understand of the why things are being set up the way they are, you know, the 6 feet distance, like you guys are medical people, you know, you're a nurse. I don't know if you are, but I wouldn't be surprised if you were trained in, you know, in medical. But what does that 6 feet do? Because basically, can we inhale it from someone else's breath?
So it's not necessarily a breath anyways. It still has to be aerosolized. So whenever you think of, I think tuberculosis is usually the common example for an airborne illness. So again, myself breathing right now, I would be expelling pathogen. However, in this case, you actually have to aerosolize it. So that's where you see, if you see a video of somebody sneezing and they've got a black background against them right here, and you can just see all of those little droplets come out into the air. So every cough and sneeze that an infected individual has would release some of those droplets. And then primary mode of transmission is while it's hanging in the air, you inhale those particles.
Right.
Or it's on, say, a surface and it's still staying alive within a couple hours. You touch that, touch any of your mucous membranes, your eyes, nose, mouth. That would give it also kind of a route of exposure to introduce it to the body.
And it can hang in the air for up to 3 hours, I read. Is that correct?
Yeah, they're still learning a lot about it, but this one appears to have some ability to hang in there. So
somewhere between 2 and 4.
And stay on surfaces for up to
depends
3 days.
Depends on the surface, the temperature, exposure to sunlight. There's a lot of variability, but I know some of them can vary from just a couple of hours to a few days. days, depending on their ability to actually absorb material and at the same time their exposure to heat differentials and different variances of sunlight hitting it.
And you've probably have you ever experienced when you're talking to somebody and it's almost
They
like you
spit
spit
it,
a little
spit
bit?
on.
Yeah, like they
Mhm.
spray. So all of that counts, and we just need to keep
6 feet.
keep that distance. 6 feet is a minimum. I mean, I say the more the better. We're learning new things about this thing every day. We could read nonstop to the point that it's overwhelming sometimes about what changes on a day-to-day basis. So 6 feet's a minimum, and we need to stick to that, and we need to protect other people with it. I noticed I did some grocery shopping for all of my people that I would call immunocompromised Saturday, and people were for the most part trying to do a really good job, but the aisles are tight, and keep moving. Don't stop and shoulder to shoulder and hang out at the same milk spot. I caught myself wanting to hang back an aisle and wait for him to kind of the train to move. Those are all smart things to do.
We're starting to we're starting to see things really pick up here. The local grocery store is doing delivery, even carry out
Yes.
options where you don't even have to go into the store. If you're shopping at CNR Market in Edina, you can call ahead and have your stuff put together, and they will bring it out to your car for you, where you don't even have to go inside.
Mondays and Thursdays, you can call CNR, and they've got a long list of volunteers that are going to bring that to your porch, set it down, and walk away, and you've got very little interaction with them, and probably no face-to-face interaction with them. And Mason talked about that population over 65, but we also have what's reported to be 22.1% of the population that's disabled. I can't tell you from what, but if I took that number alone, or I took the 16% who were reported to be diabetic, or the people that have heart disease, I would say there's a large chunk of people out there that really owe it to themselves to be careful and stay away from people right now.
Stay away from other people.
Get it over the phone call. I mean, I'm calling friends and neighbors and family members. Call and talk and FaceTime. I'm not very techie, but I know the kids all have that ability. It's, the PlayStation world and the game world, and we can get our social interaction in many other ways. We don't have to be face-to-face.
We do have a demographic, like a pretty, I would say, not big, but a remarkable one that does not compute. People that do not own cell phones, people who do not use the internet, they do not email or, look at computers. They're basically solely relying on word of mouth and some of the older ways of how information travels, like they read their newspaper, they listen to the radio.
We talked about that last week. I've checked into some of our, what I would call private communities, cultural communities, and some of them told me, I said, how do you get your information about coronavirus? And they said from the paper, from the print paper. They wait for the print paper to arrive. So we're trying to reach out to our private schools and our private communities or cultural communities and make sure that they're also aware of what's going on, so that we're all, going through the same things, the same requests for school closure, the same requests for social gatherings.
And we have 5 or 6 private schools just here within Knox County.
We do.
Okay.
Yeah. And so we're in touch with all those communities. One other thing I wanted to talk about, a lot of people, up until even over the weekend, I had some calls, people asking about the orders that are in place. The orders in place still remain, that no social gatherings of 10 or more, and that includes special meetings and things. You should keep them under 10. We had one here last week in our conference room. We had to keep it under 10. And they should be able to 6 foot apart from each other. And if that means you have to have 2 meetings, you have to have 2 meetings to get everybody educated. We're encouraging people to do as much by phone and Zoom as they can possibly do now. There have been a lot of private businesses that have opted to close their front doors and not let the public in. And that is fine. As an independent, you can always take the rules further than they are as mandated by law. We also still have the carry out, pickup, or what were the 3 ways that it was stated? Restaurants can essentially, you can order out, you can curbside pickup, or you can do delivery. So that is still in effect. We have had some calls from individuals concerned about the orders being followed. And what I would tell you is it's like any other report that comes to us in restaurant regulation or environmental regulation, whether it be sewer, water, whatever. The best thing you can do at the time is, if you have a true concern, address that with the owners or call the city or county police and let them talk to people at the time. If you call me 2 hours later and tell me you don't want to give a name and you want me to follow up on it, that's not going to work. So we have to address those things as they happen. It's hard to back up on that kind of stuff. And we just want to educate people. So that's also important to note. As we begin into this order, it's not about laying down the law and handing out citations. It's about educating people and trying to make people understand why we're doing things the way we're doing it. And it is for the community greater good. I know that this is difficult for people. And we all have we talked about earlier that it seems like everybody I talk to has some way in which this coronavirus has affected their family personally, without being a positive sickness in the household. So I just ask people to hang on, hang with us, and let's see where we go.
And continue to social distance.
Social distance. And one other thing, while I've got you here, I want to talk to our snowbirds. So it is the time of year when some of my favorite Knox Countyans return home from all over the country. Got Arizona, Texas, Florida. If you can hold off for a while until these peaks cease, that's going to be the best thing to do. But if you're headed home,
or just got home,
the best thing to do as a family member or friend is set that person up with 14 days of grocery, commodity goods, and make sure utilities are on, and then ask those people to stay self-quarantined and self-monitor for 14 days. And I'd really like for them to check in here at the health department at 397-3396. We'd like to put you on a list, and just kind of keep tabs on you. You need to be checking your temps. You're coming out of states where there are outbreaks, into a state where there are outbreaks, and we just want to make sure everybody's as safe as they can be. The other thing that's coming upon us is turkey season. There was a big wild turkey in my front yard, and the boys went chasing it Saturday. And it reminded me that we have a lot of hunting cabins throughout Knox County. And those hunting cabins are owned or rented by people from all over the United States, primarily the cities, St. Louis, Chicago, Illinois. One thing that we're going to see is that the benefit of being rural is that this disease has not, by positives, blossomed here like it has in those areas. I really want to encourage people to think about stay-at-home orders. When the state of Illinois and the city of St. Louis and St. Louis County say, I'm issuing a stay-home order, it's not meant to scare you into running into rural Missouri to cabins and to hunting places, because all we're doing is taking the opportunity to carry things with us to other places. So I really encourage people to talk to their friends and families and neighbors, and let's set this one out. Let's not make a trip into Knox County to do some of this stuff right now.
And let me take it a step further and say, for those who don't have a big family, I know it's not common, but there are people who do not have a big family or a lot of people that they can rely on. The churches of Knox County have really stepped up to the plate and filled a huge necessity to be a go-between, to help people as much as they can. They're signing up volunteers and doing a lot of community service work. And so if you're one of those people that live in Knox County and you don't have anybody to call on, you actually do. You can call here to the Knox County Health Department. Yes. You can call to any of the Knox County churches, regardless of what your belief background is, any Absolutely. Of that, and talk to people if you need help. Please reach out, because it's there for you.
The idea is to keep us all as well as possible for as long as possible. So whatever we can do to help people stay in compliance with the orders and get through this period of time, that's what we want to do. I know Mason is on top of all the news and the statistics, and we're so happy to have him. And he's serving multiple counties. And so one benefit to that is, I call it his grounding, because when it started outbreaking in the 10 counties we serve, I said, Mason, I think it's time you take things by call. But he's talking to me about cases in other counties, and we're getting to see how that unfolds with tracking and follow-up. And there are things to come for us here yet, I'm afraid. And we just need to...
just really, any experience that we can gather from the outside, especially having those contacts in those other agencies, just helps us prepare to serve our community a little bit better.
Especially the community. And do you know how many tests have been given to people who live in Knox County? Do you have any data?
I know that no state lab ran tests have been conducted, because we are we submit those. We're not allowed to test with them, but we can submit them, and we've had none. I can tell you that it's been reported to me by various other private healthcare providers that we've had at least 5 come back negative. I don't know if there are some out there, there could be some out there that I don't know anything about. Again, we said last week, hospitals are busy, healthcare providers are busy. If they miss calling us, they usually test the people and send them home to put them on quarantine. But if you're out there in Knox County right now, please call us and let us know that you're self-quarantining, because we are not throwing down legal law on you. We're trying to make sure you have the resources and the knowledge you need to do things the right way and protect other people as well as those in your household.
On that high note, thank you so much
Thanks for coming down.
Yeah, thank you.
All right.
I'm gonna go ahead and shut down this live stream. Thank you for watching. I'm Echo Menges for the Edina Sentinel and NemoNews.net, signing off for now.
Be well.